Hello, so today I'll be discussing 3D laparoscopy and I will be talking about its historical development as well as its unique advantages compared to 2D laparoscopy, and lastly, I'll be examining the clinical applications specifically in gynecological surgeries. So, 2D laparoscopic surgery, which is what we usually see, also known as keyhole surgery, is a minimally invasive technique that allows surgeons to operate using small incisions rather than opening larger cuts. And a laparoscope, which is a thin tube with a camera at the end, is inserted through one of these small incisions, and the camera transmits real time visuals to a monitor, allowing for surgeons to navigate in the surgical space. Because of its minimally invasive nature, laparoscopes offer several advantages over traditional laparotomies, and these include reduced recovery time. Patients typically recover much faster than they would after an open surgery, and there's minimal adhesions and scarring, and this is because the incisions are small and there is less tissue damage. And along with this, there is also a lower risk of complications post-operatively, as well as reduced risk of infections compared to open surgeries. Laparoscopic surgery has become a gold standard for many gynecological procedures, including laparoscopic hysterectomies. However, traditional laparoscopy does come with its own set of challenges, particularly in terms of depth perception, which is what we will discuss next. So, we've spoken about how laparoscopic 2D surgery has several significant advantages over open surgery. However, one of the key differences that still persists between open surgery and laparoscopic surgery is depth perception. So, in an open surgery, surgeons are able to use both of their eyes to perceive depth naturally. However, in traditional 2D laparoscopic surgery, depth perception, which is the ability to judge relative distance of objects, is lost because the image is displayed on a flat screen. So, surgeons over time and with experience have adapted to this limitation by relying on depth cues, and this includes static cues such as light and shade. So, shadows cast by instruments and tissue helps to estimate depth. Along with this, other monocular depth cues include object size, so smaller objects appear further away, whereas larger objects appear closer. Interposition, so if one object blocks another object, the brain perceives it as being closer. And texture gradient, so finer details appear when something is closer, whereas blurred details appear further away. And active cues such as motion parallax is also a way in which surgeons compensate. So this is the concept that objects that are closer appear to move faster than objects that are further away. So whilst experienced surgeons have learned to use these depth cues effectively, the learning curve is steeper for newer surgeons because of this. And so this is where 3D laparoscopic surgery comes in. So it reintroduces natural depth perception, making surgeries hypothetically more intuitive, whilst also carrying on the same benefits that you would see in 2D laparoscopic surgery compared to open surgery, as previously discussed. So, 3D laparoscopy was first introduced in the early 1990s, and the goal behind this was to enhance hand eye coordination by restoring depth perception. However, the initial systems had quite a few significant drawbacks, and this includes poor image quality as well as heavy active shutter glasses, which the surgeons would have to wear in order to see the 3D images, and this caused ocular fatigue. And the scopes that was used to provide these 3D images were also quite bulky, and this caused significant hand fatigue. And as a result of this, many surgeons were hesitant to adopt this new technology. However, with the advent of the Da Vinci surgical systems in the early 2000s, there has been a reignition in interest for 3D visualization. So, in the early days of 3D laparoscopy, it was relied heavily on a single channel laparoscope. So, there was just one camera at the end of the scope. However, in today's advanced systems, what we see is that there is high resolution imaging as well as lightweight polarizing glasses for surgeons rather than the bulky glasses, as well as dual channel optical scopes. So these dual channel optical scopes have two cameras at the end of the scope, and this mimics stereopsis in the same way that our eyes do. So it captures two separate images, and when a surgeon wears the glasses, the 3D polarizing glasses, the brain merges these images into a single perspective, and this restores depth perception. And theoretically, this should enhance surgical precision as well as accuracy that you would not necessarily see in 2D laparoscopic surgeries. So now that we've talked about the theoretical implications of what 3D laparoscopic surgery could do, I'd like to discuss clinical applications of 3D laparoscopy in gynecological surgeries. So to begin with, Song and Kang in 2021 showed that 3D laparoscopic surgeries have been shown to be as effective as 2D surgeries in terms of operative blood loss, length of hospital stay, and operative complications for benign and pre-malignant gynecological conditions. In addition, 3D laparoscopic surgeries did not have any negative effects on surgical outcomes and did not increase the surgical risk. The use of 3D systems in endometriosis or endometrial surgeries has significantly enhanced the surgeon's ability to visualize and identify pathological lesions, and this is something that does pop up quite often in research. And according to the study that I've stated, when highly skilled gynecological surgeons utilized 3D laparoscopic technology, they were able to detect a greater number of lesions compared to traditional 2D laparoscopes. And additionally, the histological verifications confirmed that more cases of endometriosis was identified using 3D systems. So the enhanced depth perception and superior visualization provided by 3D laparoscopes plays an important role in improving surgical precision, and this technology allows surgeons to accurately distinguish between normal and abnormal tissues. And the findings also suggested that certain endometrial lesions, particularly those located deep within the pelvis, are more challenging to visualize and resect using conventional 2D laparoscopic techniques. A notable example is lesions found in the cul-de-sac, a common site of deep infiltrating endometriosis. With traditional 2D laparoscopes, these lesions can be difficult to identify and completely excise, potentially leading to incomplete treatment. However, the improved visualization offered by 3D laparoscopy allows for significant better detection and resection of these deep-seated lesions, enhancing surgical outcomes and reducing the likelihood of persistent disease. So as a result of this, the risk of leaving behind residual disease is significantly minimized, which is critical in preventing recurrence and ensuring better long-term outcomes for the patient. And similar results were also seen within adhesiolizers in terms of visualization. And hysterectomy is one of the most common gynecological laparoscopic procedures, and 3D laparoscopy provides enhanced visualization of vital structures, and it reduces the risk of complications. Additionally, studies have shown that 3D laparoscopy can shorten operating times, which is beneficial for both surgeons and patients. And in a randomized control trial, which aimed to compare 2D and 3D laparoscopic hysterectomies and pelvic lymphadenectomies, it was demonstrated that 3D technology may significantly improve intraoperative procedures and postoperative results by cutting down operating time for the expert surgeons, but also by improving surgical accuracy for novice surgeons. So, thank you everyone for listening, and I hope that was really useful in understanding the potential benefits of 3D laparoscopic surgery, and actually the data that there is to suggest that this is something that can be built upon and can have some real life implications.